talk a little bit about dental implants, what benefits it has to our patients, what benefits it has to our practice, and versus, let's say, the old way of doing things, which was a conventional bridge. Now the option of implants and how we can implement that, and even use some of the technology we have available to make it more predictable.
So the best part about dental implants is that it kind of just replaces the single tooth. And people could lose the tooth for multiple reasons, whether they broke the tooth, whether there's infection, there's just too much decay and we can't get any hold on this tooth for any sort of other restoration. We take the tooth out, we let the bone heal, maybe with some grafting or such, so that bone is good for the implant. And then once we get the implant in there, you put the crown on top of it, and it's almost like a real tooth is back. And the best part about that is that you don't have to touch the teeth next to it, which is what we used to have to do in the past with a fixed bridge. You have to attach the old tooth that we're trying to replace to the teeth next to it, and sometimes those teeth are fine. And I am all for saving teeth as long as possible and would love to just leave teeth alone if we can, and this really allows us to do that. The other great thing about it is that it can mimic more of kind of what was there before, and it's a lot easier to keep clean. It's not sticking anything underneath the bridge. You're just treating it as its own tooth. The only thing where it comes in to be like a little different is that yes, it's a piece of metal in there. It doesn't bounce the same or whatever, but it's a hard thing, and I would rather so much have that than an empty space in general. If anyone has like a space and there's teeth on both sides of it, either they're getting food stuck in there, they're getting their tongue stuck in there. This way we can treat just the space and we don't have to treat the whole area. Of course, if you have multiple teeth missing, using implants to treat a larger space is also very doable, and the benefit of that is that it becomes fixed in place rather than a removable partial, which is great for some patients. Sometimes having something that you can take out is a wonderful option, but some patients it just works better to have it fixed in place. And in that sense, we can plan it all with our new CBCT machine that we have, our 3D imaging, our 3D scanning. We can plan it all from start to finish on a computer, and then we can implement it all, place the implants, make the all-in-4 prosthesis or just the bridge, and then they replace those teeth and they don't have to worry about it anymore. I think that the old ways of doing things have their places. A bridge is great for some patients. A removable prosthesis is good for some patients. But an implant has made it really nice for those patients that maybe just split a tooth, everything else looks really great, and we don't want to leave this space. And I think it's been really fun to be able to learn about it, and now I'm really looking forward to implementing it in the practice.